government expected to introduce updated regulations as well as other regulation that pertains to the restriction of COVID-19 from spreading. The previous restrictions are due to expire at midnight, at least the remaining ones. Now, it is expected that an updated mandate will keep the country's mask mandate in place. All previous regulations were promulgated under the state of disaster laws, which allowed for the imposition of masks and even a ban on alcohol during the pandemic. Now, there has been a widespread backlash against many of the regulations about their constitutionality and a plethora of lawsuits from some industries and lobby groups. Now, joining us here to discuss a little bit more whether any updated regulations should enforce the mask mandate or not are South African Medical Association chairperson Dr. Mvuyisi Mzukwa, as well as virologist Professor Schoub. Gentlemen, good evening, and thank you very much for your time and joining us tonight here on In Focus. Suppose before we talk about the question of whether to wear the mask or to keep them off, the immediate question that comes to my mind would be, what is the level currently of personal concern about COVID-19, one from health professionals, but more importantly, from the people themselves? Are people still feeling personally vulnerable to COVID-19 at this particular point? Dr. Mzukwa, let's begin with you.
Good evening to you, Thabo, and to your viewers, and good evening to my fellow panelist, Barry. Look, I think from the healthcare professionals, there's obviously still a concern because we still see not so many admissions, but we still have admissions that are due to COVID-19, and we still see people dying. And you will understand that most of the healthcare workers complained of burnout and all these things. So anything that is to help curb the spread of this virus, like your preventive measures, including vaccinations, that would really be an issue that will be applauded by healthcare workers. But regarding the public, I think to a certain extent there is that sense of laxity, where you find that in the public spaces, in the taxis, in the public transport, also in some. I've been to a funeral recently, and where I think there were 2 or 3 of us were wearing a mask. So I think there's that sense of relaxation, to that may make people think that COVID is done. There's we're no more having COVID. But if you're out there and you listen to the news and you attend to doctors as well, we still diagnose people with COVID-19. So it's still out there. But I think the level of awareness, even the level of trying to protect yourself from the COVID-19 is going down.
Yeah. Prof. Schoub, adherence to COVID-19 health measures varies considerably depending on where you are. As Dr. Mzukwa says, sometimes in a text you'll find others would wear their mask, others will not. Does this say we have different perception of COVID-19 risk currently, and what are the factors that drive that perception?
Good evening, Thabo. Good evening to your viewers. Also, good evening to my colleague, Dr. Mvuyisi Mzukwa. Nice to be on a panel with you. Yeah, I think this is. I think Dr. Mzukwa put it very well. There is certainly a growing level of apathy. We've been in this now for 2 years, and I think you have a spectrum, like with any other kind of perception of health risk. You have some people that are, in fact, I would say even verging on the pathological fear of we call germophobia. And they've, in a way, kind of closeted themselves, they've locked themselves up. I think that's wrong. And then you have a kind of a large bulk of people, and we see it out in all our kind of engagements with people, out in the streets and at functions and shops and malls and so on, who are not wearing masks because they kind of feel that the pandemic is over. And I think this is a wrong perception. The pandemic isn't over. But many people kind of feel because our particular variant, which is circulating at the moment, the Omicron, causes a mild, relatively mild degree of infection, I think, well, this is just another flu. And this is incorrect, in fact. The pandemic isn't over, and we still do need to retain some, you call them restrictions, I'd rather call them infection prevention measures.
Yeah.
They still need to retain.
Well, I mean, that links then to the next question. Is there a direct link, as you put it, to these preventative measures or behavioral measures and adherence to these behavioral measures and high risk of infection and mortality rate if there is no compliance?
I think there is a link. I think it's been shown in many, many studies. I think it's been shown, for example, in many of the European countries, the United Kingdom and countries in Europe, where most of those restrictions, in fact, have gone, and in the United Kingdom just about entirely have gone, and they've had quite a steep rise of infections. Not only ordinary infections, but also people with severe infections landing up in hospital. And I think this has been repeated in many parts of the United States, for example, as well. So there is a direct correlation where these restrictions are dropped, the infection does rebound and increase. Fortunately, at the moment, most of the infections are relatively mild to moderate.
Yeah. Now, Dr. Mzukwa, the little bit I've read about it is that the different perceptions of risk are largely driven by personal experience with the virus, or maybe a family or a loved one having been affected, but also they are, of course, by and large, not driven by a collective perception or a South African perception of what we think the virus is able to do or can do. So, in that kind of instance, would a communication campaign of any sort really help? Because what drives people's perceptions is really how they've experienced the disease where they live. I mean, a lot of people in the township would say, well, we don't see it here. No one has been affected here. Although we do know that it's in the township and many people have been affected.
Yes, no, that's correct, Thabo. I think what perhaps is, to a certain extent, lacking in our approach with dealing with the pandemic is the side of health education, that is focused on this virus itself. I understand that, there are programs like yours where you find, healthcare workers, even experts, talking about the virus. But I don't think that it reaches, the larger population, in terms of, other people that should get the message. And I do think that there should be a strategy, that goes out there, even with this issue of what you've referred earlier as restrictions. And you got another terminology from Prof. Schoub. I do think that we need to stick more to education, not to rely on restricting people, in terms of, fighting whatever communicable disease that we are dealing with. I think education is very important. I remember in 2019 when I visited Japan, and a person who is having a flu wears a mask, and that was way before the announcement of the COVID-19 pandemic. You just see a person, wearing a mask, you know that person has got flu. I think those strategies, where people are not coerced, I would rather go with education than, forcing people to do things, and rely on that, because they tend not to respect such approaches.
Yeah. Will low compliance or non-compliance at this particular stage undermine the public health efforts that we have already put in place, the number of vaccine penetration, et cetera, and we've got also some reports that are saying even the natural born immunity is now beginning to wane a little bit. So if we have low adherence to these health measures, will that in any way undermine the work that has already been put in? Dr. Mzukwa?
No, look, we're dealing with a pandemic, and we need to be using multifaceted approaches, when we deal with this. We can't rely on one thing, vaccination or other health preventive measures. We must use that combination of all, to be able to fight this. So when there should be washing of hands, we should be washing hands. If there's a need to put on a mask, we should be putting a mask. But also, we should be covering ourselves with vaccination. So it's a combination of factors. We can't pick one and leave the other. So it's important that the message, when it goes out there, it does not portray only one aspect. It must be all-encompassing.
Now, Prof, of course, the conversation now is the extended mandate lapses at midnight, and therefore we need to put something a little bit more permanent in place as far as regulations that will now govern how we live with this disease or this virus, this enemy that is still invisible, that we cannot see. So what do we want to let go of in terms of our approach? What do we want to retain?
Yeah, thanks, Tom. Well, I think the one thing, and I think it's been mentioned, is wearing a mask. I know people are getting tired of wearing masks. It can be uncomfortable, particularly in summer, less so in winter. And I think a mask mandate indoors, I really kind of personally feel that should be retained. I think for a number of reasons. There are really actually three main reasons. The one is that mask does protect you from getting infected. There have been innumerable studies showing that in incontrovertible evidence. A person wearing a mask is probably reducing the risk of getting infected by at least 50%, if not more. And if the person you're coming into contact wears a mask, it goes up to about 80 to 90%. So you protect yourself. Also, it's been shown in many studies that you protect other people. You protect if you happen to be infected. And we know that a large proportion of individuals don't know that they're infected. They're what we call asymptomatically infected. So you protect others as well. And there's a third reason as well, and that is that if the mask will prevent people circulating that virus in the population, in the community. And it's that circulation of the virus which gives the virus the opportunity to make the new variants, to make the new mutations, which ultimately end up into variants. So there are three good reasons why I think the mandating mask wearing indoors should continue. Outdoors, obviously, the risk is very much less. We all know that, one can relax that. And then also, I think the restriction on crowding, on congregate settings, I think that also should remain. And as Dr. Mvukwa says, it's not only for COVID. We know that in the Orient they've been wearing masks for centuries. And we know that reduces other respiratory infections. And we saw that in 2020 and 2021, that the incidence of influenza dropped markedly. So I know that people are getting tired of wearing masks, but if one wears masks correctly over the nose and over the mouth, as the state president has often said, I think we can reduce all respiratory infections. And I think that will be a very great public health step forward.
Yeah. Dr. Mzukwa, what do we let go of? What do we retain?
Yes, I think I agree with Prof. Schoub that, indoors, honestly, we still have to retain the mask. But, I would then add to say, even if you're outdoors, if you're symptomatic, for example, and you'll be meeting people outdoors as well, you're symptomatic, I do think that you need to protect people that are around you, for that particular reason, And, but also the issue of sending people for quarantine, issues of prolonged isolations, I think they need to be reviewed, and I think some of them we need to do away with them, because at times, the issue of quarantine at this point in time, in this stage of the virus or of the pandemic, I don't think it's helping. So I don't think we should retain such things. And also encourage vaccination. I think we still have serious problems with vaccination hesitancy. where you find that people still have questions around whether they should have a vaccine, what are the side effects, whether they are safe or not. I think even if you have questions like those, it's normal. You need to approach the right people. I don't think social media will answer questions, health questions. When you have interest in, attending to your car or whatever the thing is, you don't go to social media, you approach the mechanic. So I do think that also when it comes to healthcare, there are healthcare professionals that we need to approach when it comes to issues of health and get answers directly from them, because they are trained, they are experts in that field.
Yeah. Now, we are, of course, having, even as we speak now, the economic cluster having conversations around recovery and going back, at least economically, to pre-pandemic state. What was important during the pre-pandemic that we want to go back to? I'm asking this because one of the things, for example, is mass gatherings for concerts and sporting activities and so on and so forth, and political campaigning. Churches, for example, want to go back to pre-pandemic gatherings. What was important in pre-pandemic that we want to go back to, or those things completely now in the past and we will never see ourselves back there? Let's start with you, Dr. Mzukwa, and then we'll come to Prof. Schoub.
Yeah, I think Thabo, there's many issues. It really depends where you stand. For example, if you are in the economic cluster, you would be looking at how these restrictions are impacting on your activity. Obviously growing your business and stuff like that. Same applies to recreational sector. They'll be looking at things like those. But also we need to, consider the fact that we are not out of the woods as yet, in terms of the pandemic. People, even if they want to go back, to the pre-COVID period, I don't think at this point in time we are, ready to do that. I mean, at any point in time, we might get a new variant. I know that now we still have, sub-variants from Omicron and stuff like that. But what if we get a new variant? We don't know how that variant is going to behave. So we do need to protect ourselves and also, prepare, have a way of dealing with anything that may come our way. I think it really depends on where you stand.
Yeah. Prof, reflect on the pre-pandemic important things that we need to go back to or to do away with completely.
Yeah, thanks very much, Thabo. Look, I think over this past, now even more than 2 years, we've learned a lot. Scientifically, we've learned a lot. Socially, we've learned a lot. Economically, we've learned a lot. And I think we need to kind of, take this knowledge and apply it rationally and sensibly. Like for example, one of our major industries is the tourism industry. And I think, for example, entry requirements into the country, I think they need to be revised. I think there's no real kind of value in insisting on people being either PCR positive or even being vaccinated, because the amount of the kind of risk of introducing infection from travelers, I think, is minuscule. And we need to kind of balance how important that risk is as against the economic fallout, for example, in the tourist industry. I think we need to encourage that industry. It's so important for the country. And I think similarly we need to look at other industries and see where one can balance the need for economic recovery versus the public health need. But wearing a mask indoors in many situations, and particularly where people come into close contact with each other, I think is not really going to impact economic recovery to a great extent in the great majority of cases. And there one should, in fact, retain those public health measures which are not going to affect the economy.
Yeah. Very quick one as we wrap up. The transitional measures, of course, are lapsing today. They were given 30 days. In that 30 days, there was some consultation around the new regulation. As I mentioned in the beginning, that regulation is being heavily challenged in court. What's your view? Should they be extended a little bit more while we work out the legalities as they end today, or should we adopt the regulations as currently being set out? Prof?
Thabo, I'm just a humble virologist. my legal knowledge you can put in a postage stamp. No, I would think that, to be quite honest, as I say, as a humble virologist, I'm not sure I can see a tremendous difference in the State of Disaster Act and the National Health Act. So if those minimal amount, and it's minimal compared to what we had or what we experienced in the past, of restrictions can be effectively retained under the National Health Act, then I think it's probably better to keep it under the National Health Act, because these are public health measures. But as I say, I'm no legal expert by any long way.
Indeed. Dr. Mzukwa, some experts have weighed in, doctors have weighed in as well, particularly around this whole question of placing the COVID-19 infections as a notifiable disease, and there's a whole lot of debate around that. Should we pause a little bit, maybe extend this transitional period while we work up these legalities, or are the regulations good to go?
I think what we should have done in the first place, I mean, this is a very important matter. We believe we should have been given enough time. I mean, from the association point of view, we've got members on the ground. We do need their input. I mean, we've made our submission, regarding these regulations, but we felt, the period was very short, and knowing that this is going to impact on people's lives and their rights as well, I do think that we should have given enough time, for consultations, and making sure that, we don't impact negatively on other people's lives, even economically. So I really think, the inputs also, there were complaints that some of the inputs were ignored. I'm not sure about that, but I think, there should be that transparency, from government, to show that inputs that came from the public were taken into consideration. It will help with the trust, that is lacking between the public and obviously, and government. So it's important that we make sure that those issues are attended to.